Not into long podcasts? Don't worry, we've got bite-sized clips just for you. This is CWN Clips. Please don't forget to subscribe. No, I think it's a very fascinating place to be in at this
Yeah,
point with the amount of AI and the kind of data we are able to get through different forms, right?
exactly.
So, yeah.
Yeah.
Uh,
Like we recently had, coming to AI, we recently had a talk about how AI is going to change medicines, right? I think everybody is talking about in different specialties. So the conclusion was that if you adapt AI, you will be a better doctor. It's not like somebody is going to take your job, but you have to be part of this AI revolution for you to get maximum benefit. Like what you were just telling me, in my field, especially in DBS, I use AI a lot. We
yes.
have now devices which will analyze the waveforms in the neuron. Previously, what happens is I used to go through looking each area and analyzing it. Now the AI analyzes the whole waveform and tells me, Dr. Raghuram, this is the most probable area where the STN nucleus is. So you understand? So that way AI has helped me refine because it has so much data from multiple centers. It has analyzed those patterns and got to that stage where it is going to tell me that this is the right area for you to put the electrode.
Because since you started the conversation on the AI, I wanted to, you are championing a lot of robotics surgery
Correct.
as well for the, especially, in your practice. So please talk about that, right? Robotic surgery, remote assistance, and AI, you're
Yeah.
saying that, it's actually helping, right? So maybe
Yeah.
uh, how you think the future would is looking like, right? And what is your message for the young neurosurgeons and medical students to actually start understanding the technology as well while they are
Correct.
practicing?
Correct. Yeah. So definitely the younger generations are much more smarter and they are more adept at using the technologies. We all know that, maybe because their mother started it when they were baby to eat also, they give them the phone, you Google, you search, you choose. So that way the youngsters are much more adapted to the newer technologies. And in terms of robotic surgery, definitely there are robots in neurosurgery and robots in other departments. If you compare that, the robots in neurosurgery do much more basic work compared to the robots in, say, general surgery or oncosurgery or urological surgery, because we don't have a cavity. Usually these robots are arms which go into the cavity and then operates. So that's how the surgeon just sits on a console and controls the movements of these
Controls.
robotic hands. Yeah. In brain, because it's not a cavity, it's a structure which is filled with brain. We have robots which push these electrodes into the brain. We have robots which push pedicle screws which we put into the spine into the screws. So it's not like it is completely independent. It is surgeon controlled, and we don't do so much of full surgeries with the robo. We do a part of the surgery with robo, and the rest of it the surgeon has to do. Except for the act of pushing the electrode, the robo or pushing the pedicle screw, the robo does not do. I have used the robos. It is very useful, especially when you have to do multiple electrodes for a, say, epilepsy patient. So there is definitive role, and that is going to be the future. So if
Future.
you really are a young neurosurgeon or a medical student, there is no escaping from learning this technology and learning how to use them effectively.
Yeah, I think it's going to enhance your skills and also
Correct.
solve a lot of things easier for you while you're focusing on how to actually help the patients do better, right?
Correct.
That's true.
So there is no doubt. See, that's the whole idea, right? All our goal is to make the patient quality of life better and get better results. So I think there is nothing saying that you should not accept these technologies. I understand the old timers may probably say that
Hmm.
you're, like we were discussed in the beginning, right? That you're not using your brains enough. It's not like that. You try and use it in a way that it is beneficial to the patient in the
Right.
maximum, and you reduce the errors, right? We
Yeah,
want to
yeah.
reduce errors and maximize efficiency. So that way, I think we should adapt technology and move forward.
Yeah, as you rightly pointed out, while it might take probably 2 3 hours or even a day for analyzing the entire data which has come from different imaging, but now it's easily done without any missing any small information
Correct.
intricacies as well and given to you, so which
Correct.
is actually helping you to take more patients or look at patients much more faster than it could have
Correct.
taken earlier, right? So yeah,
Correct.
it is definitely breakthrough. This is just a glimpse of one of the many conversations we've had in this channel. If you found this thought provoking, please don't forget to subscribe and explore more insights from unfiltered voices and the real world experts. And please don't forget to like and share this video to as many people as possible. it keeps us going. See you in the next one.